Assalamu alaikum and good afternoon. First of all, I would like to thank the management of Black Hole to provide a forum to discuss the contribution of nurses in national economy. So thank you very much, the management. I welcome to the all audience in this panel discussion. The topic of this panel discussion links with the theme of International Nurses Day 2025. Our future caring of strengthening nurses play a vital role not only in healthcare but also in economic development through labor participation, healthcare cost efficiency, public health outcomes, and more. In this panel discussion, we have experts from nursing profession who highlight the contribution of nurses in national economy. So let me introduce briefly about the panelist, Dr. Sajid Iqbal, who is the Associate Professor at Shifa Tameer-e-Millat University. Next to him is Ms. Sadia Farhan Khan, who is Assistant Professor at Shifa Tameer-e-Millat University, and Ms. Huma Rubab, who is Assistant Professor at Shifa Tameer-e-Millat University, and she is also PhD scholar at Shifa Tameer-e-Millat University. So my first question goes to Dr. Sajid. Sir, how do nurses contribute to overall economic output of healthcare sector?
Bismillahirrahmanirrahim. Thank you, Mr. Afsar, for this important question. Actually, all the health sector is contributing a lot to the economic growth of the country. And particularly, then this is the consecutive second year that we are raising the voice for economic power of nursing in any country. And it is because that often the contribution of nurses in terms of economy, it is often overlooked across the world. And if you see the overall contribution of the health sector to the GDP of Pakistan, it's 2.9% approximately, while WHO has recommended 6% of the GDP for the low and in middle income countries. So we are still far behind in the recommended attribution of the GDP towards the health sector as an overall contribution. While if we talk about the nursing, it is not yet calculated, not yet recognized that how much nursing is contributing to the overall GDP of Pakistan. And therefore, not recognizing this reality and not giving it the credit which it deserves, it will in long run lead to different consequences which may include demotivation, brain drain, which we already facing up to a large extent. And similarly, the long-term repercussion, for example, if there is under number of the nurses in the country, as it is for the last whole decade, we need almost 0.9 million nurses at this time in Pakistan. We are short of this number. So it will, in long run, lead to the poor workforce, which, like the citizens. One of the long-run outcome of the nursing profession is to produce a healthy society, and by that mean we can increase the productivity of the country as a whole. That's why we want proper recognition and proper contribution of nurses towards the economy of Pakistan.
Thank you very much, sir. My next question is from Ms. Huma. Can you highlight, Ms. Huma, in what ways the nurses help reduce healthcare cost?
Thank you so much, Sir Afsar. And first of all, I would like to thank the Black Hole team for inviting us and giving us opportunity to talk on this topic. And as well as I would like to say Happy Nurses Day to everyone all around us, all the nurses. And coming back to your question, sir. Please repeat your question.
Okay, thank you. Your question is, in what ways do nurses help reduce healthcare cost?
Okay. So the nurses, they have multi-dimensional roles, and always we have heard about nurses. They are always the care provider and taking care of the patients, right? Other than the taking care of the patients, they are also working as an advocator, as an educator, as an and the primary healthcare settings. They are working on the health prevention and promotion as well. So if I talk about the early screening, which is done by the nurses, they can help in preventing the long-term complications or any implementation of any chronic diseases. Same goes for the case of vaccination. The nurses, they are working in the primary healthcare settings, and they are providing the vaccination and campaigns, and they are doing at that forum so that they are able to save the cost of the future, like for example the patients who are coming to the hospital and having admissions. I just have an example. Our recent student of masters in Shifa Tameer-e-Millat University, he just conducted a research on readmission of a discharged patient through discharge teaching. Basically he provided the discharge teaching and looked at the readmission rate on the heart failure patients. So it was quite interesting to note that the results were quite abundant, that providing discharge teaching to the discharge plan patients help in reducing the readmission rate in the hospital. So if our nurses, they are looking at providing the teachings to the patients, they are able to reduce the readmission rate of the patients. And even I just give you example of a patient, right? If a patient is suffering from any kind of chronic disease such as diabetes, and if they are being taught about how to take care of themselves, providing the self-care management, right? So they are able to reduce the complications such as diabetic ketoacidosis and others. So because they will learn the process of how to monitor their glucose level, how to administer the insulin, right? So these are small basic steps, small basic techniques which will help them to regulate their lives and prevent them from complication and readmissions. And it is not only reducing the cost of the patient, but also making them independent in taking care of themselves, right? So our goal is that we make our society, our community self-sustainable, right? We should not be dependent upon the doctor, the nurses. So our role is on the early detection, on early screening, health promotion. We are not only focused on the disease. Yes, I said that, we are focusing on the chronic diseases, but we are also working towards the health promotion, those areas where the health can be promoted, right? We are working towards the teaching regarding the securitizations, right? So basically, this can ultimately reduce the risk factors that can then can alleviate the diseases processes. So ultimately, these are all the steps which are contributing towards the cost reduction in the healthcare settings. So the nurses play a very vital role in reducing the cost in the healthcare settings, whether that is at the hospital level or the community levels. Even they are providing the one-to-one educational counseling sessions, right? So multi-dimensional roles of the nurses have been highlighted through this forum.
Thank you, Ms. Huma. There are several ways that a nurse can save the cost. Thank you for highlighting very real examples. My next question is from Ms. Sadia. What proportions of the national workforce is made up of nurses, and how does this affect labor market dynamics?
Thank you, Sir Afsar, and I would really appreciate that today the Black Hole Management has given us opportunity to talk on a very, very important theme regarding economy. And economy is the main circulation of any nation. So when I have gone through with a literature search regarding it, the real eye-opening fact has been that from 2024, if we see that how many nurses is being registered. So 1 lakh to 1,21,000 registered nurses serving a population of 240 million thickly populated Pakistani nation, which is very, very low ratio. And if we just look into the nurse to population ratio, then 5 nurses per 10,000 individuals. This figure is significantly lower than the World Health Organization recommendation, that is of 40 nurses per 10,000 population. So the impact you can figure out by yourself, that it will be enhancing the work burdens on the nurses. Beside this thing, burnout among the staff, then the skilled nurses, when they are not sufficiently managed, so they can migrate. And this is one of the burning issue nowadays we all are seeing. Then the most important thing is that our nurses required the quality education and training challenges as well in our country because of it. So policy and investment needs is also one of the important aspect that can impact on labor market dynamics. Thank you.
Thank you, Ms. Sadia. Again, Dr. Sajid, will you elaborate that how investment in nursing education will influence the development of country's GDP?
Okay, so as far as I am concerned with it, I feel like we cannot take into consideration only the shortage of nurses in terms of numbers, because the quantity alone will not address this issue. We have to keep the quality of the nurses alongside, and even the first thing we should consider is the quality which we are producing. And for that purpose, we need proper investment in terms of material resources, like development of specialized training institutions, and then their monitoring and inspection quite on frequent basis, and the teachers which are serving there. So the first thing, if we need to address the shortage of nurses, is to increase the number of the educators who will produce these nurses. If we will not give attention to the first thing first, then we won't be able to address it up to the standards of the world, and we won't be able to produce those nurses who can serve across the countries. Therefore, in investment in proper educational system in terms of human as well as material resources come first. And then I must say that an independent body for their inspection and audits is equally important aspect of it, because that is the body which will ensure that the things are up to the mark and the quality is maintained. So in this situation, if we are hearing the news of merging of our council with some other councils or some other organization, it will not increase, it will not contribute to what we are discussing here.
Sorry, sir, I will interrupt you here. That so far is Pakistan Nursing Council is the regulatory body that is do surveillance of this quality of education. So in future we came to know that Pakistan Nursing Council is merging with another bodies of health regulatory, and its name is changing. So will it be able to recognize, or will it be able to maintain the same quality of education in nursing?
Of course not, because diluting the nursing profession and mixing it with the others will lose the focus in first place. That is understood by everyone. Like, if one council is monitoring the quality and sustainability of the trainings in Pakistan, and on the other hand, if another council is taking care of multiple allied health sciences discipline, of course the focus will be lost, and it won't be sustained at that level which one body can take it up. And if we have objections like the current body, the current nursing council is not doing it up to the mark or up to the expectations. So we should strengthen it. We should work on the work force and the people or the human resource which is there. We should strengthen that resource and we should train them properly how to monitor and how to sustain the quality of the nursing education in the country. Rather thinking of merging it with another council, that is not a solution. The solution is to work on the problem. The problem, if it is the quality, we should improve the quality.
Very right, sir. Thank you very much. Yes,
Sir, I
please.
would like to add in it.
Yes.
If I think about the merger, to me, it is a sense of insecurity, right? Because I think that when we are being provided a platforms, we have always been talking about that the nurses, they should be upgraded and they should be uplifted as they are working on many domains and many things. So we as a profession, we want to uplift our profession. So this is our autonomy and our identity, that we have our own regulatory bodies, and even in the international level, we have been recognized as an separate identity. So if there is a merger, then there won't be any kind of autonomy, there won't be any kind of identity. And when you will be applying for abroad for any kind of attestation, any kind of accreditations, then there will be a very much problems as we are facing right now. If you are applying because we have a separate identity, then in that case they will be applying through that identity, like Pakistan Nursing Council. But when there will be a merger, in that case our autonomy, our identity will be lost. So we are there always to talk about our uplifting of our profession, but to me it seems like by doing this we are degrading our profession, or we are just suppressing it down.
Yes, you are very right that apart from the quality of education, recognition of nursing profession will also be lost. That is very important, one of the most important implication of this merging the Pakistan Nursing Council with the Allied Health. So thank you very much, Ms. Sadia. How do wages and working conditions for nurses compare across different economies, and what are the implications for migration and brain drain?
Saraf sir, being very honest, there is no comparison. Because if you see the clinical areas where the nurses are actually the front battle soldiers, the work they have done and the expectations of taking care, in lieu to that, the wage they have, it is so low that a nurse could not take care of the family needs. Because most of the nurses, they are bread earners of their family. And once they've been, there, and the government enhances any inflation, then their wages will never be inflated accordingly. So the wages are very marginal level. They are not up to the mark. I have just gone through a little reality figures with me. For example, if we say Pakistan, a clinical nurse earning initially, when the nurse has been completed his 4 years and then afterwards joining any government area, so there has been discretion of public and private hospital. So in public hospital, it has been 35,000 to 70,000. That makes 125 to 250 USD. That is very minimal wage. And if you just look into the utility of our countries, their bills and everything, it is outrage. So most of the time, the nurses, family and nurses will not be able to achieve that. So then another vicious cycle started. So what happened that when the wages are not satisfactory, so there is no retention. When there is no retention, then the nurses identify as being a skilled nurses. Alhamdulillah, Pakistani nurses are very skillful. So they been given opportunities to the developed countries. So they ask them, One of our very good friends in term for nursing is being Saudi Arabia. So they are giving the wages approximately 170,000 USD, that is comparing to 125. Then why not the nurses who've been skilled, they will be draining out from the Pakistan. So the wages really need to be reviewed on all level, whether it is public or it has been private, according to the demand of those inflation that is seen by the country. So this is the very realistic picture right now. So most of the time nurses are leaving, or they whatever they have put effort for gaining a quality education, they should be come back to them. So it never comes to them in the wage form. So thank you so much.
So you mean that a lot of nurses
Mhm.
are migrating to different countries because of the reason is that in this market they are not being offered the reasonable salaries.
Suitable, the more suitable, because once they will be educating in some institution, a quality institution, it really matter of a handsome amount that they put it, and then afterwards they get the quality education. So in return, when they go for the wages, so the market gives them a very 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 low one.
Low salaries, yes. Thank you very much, Ms. Sadia. Ms. Huma, can you highlight what was the role of nurses in sustaining national economies during the crisis of COVID-19?
Okay. Actually, if I recall about COVID-19, it was, backup dream where the nurses were working 24/7, and they were always working there, and they were the primary healthcare providers in the healthcare setting, I would say. And I would say the role of the nurses over there at that time was, if the nurses were not there in the healthcare profession, then the healthcare system would have shut down at that time. So nurses played a very essential role in the providing the care to the healthcare, to the patients, to their families, right? Ultimately reducing the cost, right? For example, the patient, there were a lot of patients who were put on the isolations, right? So when the person is put on isolation, they come across many challenges, right? They are far away from their families. They have psychological problems, mental health issues, and the counseling skills they've utilized to make them calm and cool. And even the role of the nurses in preventing the spread of the COVID, right? So a simple basic technique, doing an hand washing while intervening the one patient, and going across so reducing the infection rate. So when the person is on infection, they have to go through many antibiotics and all that, right? So this is ultimately reducing the cost of the patient. So they are working on the cost and reduction for the patients, for the families, right? And ultimately it will reduce impact on the economy, right? Because when the person living in that particular community, they are obliged with the certain amount, so they are in a stable condition. So nurses, they played a vital role in providing the education, counseling, and they were very innovative in the sense they were utilized because there was shortage of the resources. And nurses, they were very potential in innovative in utilizing the personal protective equipments, and utilizing of all the resources in a very innovative manner, which ultimately reduced the cost on the cost effectiveness of the economy. So I would say nurses, they do a small little techniques by utilizing their critical thinking, right? And using their innovative and creative ideas, they can affect the economy of the nation as well.
So at the three levels, primary, secondary, and tertiary level, they had, it was a great impact on the, of course, the national economy. They used many preventive isolations, and they taught the family members, patients, preventing the spread of the infection. That has, direct impact on the economy of the nation.
Very true.
Yeah, thank you very much, Ms. Huma. My
Sir,
next,
Afsar, I
yes,
would
please.
like to add something because it give me one recall, reflect on nursing as an educator during the COVID-19 timings. That not only the clinical area, which my colleague has reflected a very nice picture, but I really want to add to complete the complete picture of that time period is being the educator. The nursing educator at that time has a big challenge that how to approach from theory till practice, because this is science and arts, not only the one aspect. In those days, none of the nursing educator made feeling towards the students that the time has been lapse or it has been delay. They turned themselves to the blended learning, and it was a big leap at that time for the Pakistani nurses and the educators. Not only the students, but first they train themselves for the blended learning, parallel to give training to the student that how to take it out. So none of the things has been delayed, and every aspect has been completed during those
You are
COVID-19
very right
times.
that regardless of the position of the nurse, whether this was a nurse educator, whether this was a nurse manager, or directly the bedside nurse, everyone was at the front, and they contributed very significantly.
And
Thank
just
you.
in a minute, I will also like to add that the nurse researchers who have conducted numerous studies, that what we learned from this experience and how people were feeling while they were quarantined, and what worked well and what was not up to the mark. So through different research studies, and I myself was involved in 3 different studies at Karachi. So they were also not on the back end, they were in the front line to inquire and learn from these experiences and disseminate our status to the whole world, actually.
Very true, sir.
Sir Afsar, I would like to, this recall me of my own personal experience. I can remember the early days when the COVID was, in the air. At them it was,
at peak.
yeah, at it in the air, and it was at the peak. Everyone was scared of that particular word, and they were, and it was in reality as well. So at that time, my family, they were saying that it's better to stay at home. You were not going to work, but I can still recall that as Miss Sadia witnessed, that we were working at that time, some as in the educational setting as well as in the clinical settings. But other than that, I can recall that there was my husband's colleague. He was suffering from COVID, and my husband came in. He said, can we go and visit him, and he needs care, but his family is not touching him, and he's in very bad condition. So he was nearby our house. So I went there, and I provided care and all that, and use of protective equipments and all that. And I teach the family as well, but after this all act, and after certain time, he then later on he was shifted to ICU and all that. But I can recall all that, and the family, the way they behaved after that was quietly different. And at that time my family was saying, when I was going there, I did not tell them that I am going there. But when I came back later on, they came to know that I went there, because my husband, he shared all the story with them. And at that time, I felt very proud to be a nurse, literally. So adding to economy is a separate, but I, as a nurse, I felt very comfortable, and I felt very happy that I am a nurse.
So no doubt that nurses are committed to their profession. Thank you, Ms. Huma. My next question is from again Dr. Sajid. What is the economic impact of nursing shortages on national productivity and public health outcomes, sir?
Okay, so indirectly, I think in our conversation we have already highlighted some of the points. And as we are again and again highlighting the brain drain, the migration of nurses out of the country. And I also, in my initial point, I clarified that in overall, if we see if the nation is healthy, if the citizens are productive, the overall GDP of the country will be improved and we will be able to achieve the sustainable development goals, and even the personal quality of life of our citizens will be improved. And in case, God forbid, if there will be shortage of nurses or even other healthcare professionals, what will be the repercussion? Different diseases will be more prevalent. For example, nowadays, Pakistan is getting almost to the top of the prevalence of diabetes in the world, which is quite like shocking because we are not that big country, and the risk factors in Pakistan are comparatively far less for diabetes than the developed world. But again, somehow we are observing that the prevalence is increasing. The same situation is for cardiovascular diseases. Even I have worked in my PhD on smoking. So most of the countries in developed world have seen a tremendous decrease in the prevalence of smoking in their countries. But see, in Pakistan, there is no declination. On the other hand, it is increased in some of the cities. So if these risk factors and these diseases, which are chronic diseases, which are compromising the quality of life of the citizens, if their prevalence will increase and the risk factors will not be, stopped at the right time, it will ultimately increase to the low productivity of the nation as a whole.
Very right, sir. Another related question I would like to ask Ms. Sadia, that how do national health policies that support nursing expansion affect economic growth and health equity? Please, Ms. Sadia.
As my colleague Dr. Sajid has already mentioned earlier, that what is the situation of GDP and how much the people who are responsible for allocating the budget on health, by seeing that if the policies are very few and like for the focusing is nursing. So National Health Vision 2016 to 2025, the main focus of this National Health Vision policy was to prioritize and strengthening the health workforce, including nurses and midwives, especially in undeserved areas like nurses where there has been peripheries of Pakistan. So over there, they will support nurses to go on those areas and work on prevention of diseases. Then Pakistan Nursing and Midwifery Council's reform is one of the policy for that, and it is being reformed. But you have just heard about it, that there has been unsuitable merger rather than to understand or strengthening of the Pakistani Nurses Council. It is been like a merger making more confusion. So it is best, it is good that being authority or body under International Council of Nursing. So it will be worked out. Prime Minister's nursing program, another policy came in late around 5 to 3 years back, and the initiative was to include expanding nursing college and scholarship to train more nurses, and it has been working well. But when the political stability is no more there, then the good policies comes and they will go into air and they evaporate. But we hope that it will be maintained in the future. Then another policy came that called as universal health coverage commitment. And in this, it is recognized the need of well-distributed skilled nursing workforce to ensure equitable services delivery. And it's mean that peripheries of Pakistan will be having a facility of nursing where they will assess and then afterwards evaluate and re-evaluate and perform need basis implementation, and then if there has been a referral, so they will start doing the referral as well. But all these policies which I have mentioned you, it is on very initial stages, and some of them still not been fully function. So there is a high dire need that the policies has to made in which the guidance and advice by the nursing personnel in them. So when the policies are made, so nurses should be there, and the nursing leaders who has a very good role in the research and public health, so they will be there and they will initiate it. Otherwise, many policies has been developed, but if they are the contributors are not nurses, so they did not take care of those aspects.
So you mean that they should be empowered, nurses should be empowered,
Yeah.
to give a contribution in the health equity.
Yeah.
And of course, this expansion of the nursing will impact the economy of the nation.
Yeah, one of the part is being as a nurse practitioner role, which is new in Pakistan, but it has been very much prevailing in other developed countries. And many of the Pakistani nurses who been brain drained from here, they are very proud, honored, titled practitioner nurses in Canada, and where the health system is very strong. They are working as a practitioner, and we proud on them as well. So why not here in Pakistan as well?
Thank you, Ms. Sadia, for saying nurse practitioner. This is another, new concept in Pakistan, although, it has not been started yet. So my related question, this is the last question, but not least, from Ms. Huma. What is the return on investment of employing a nurse practitioner in primary care settings? Please highlight.
Okay. Role of the nurse practitioner in the primary healthcare settings, return of investment, right? So basically, when we are talking about ROI, is basically talking about the measurable benefits. It could be financial and it could be non-financial. So hiring a nurse practitioner in the primary healthcare settings, as we have already discussed about the different roles on where the nurses are already working on as a primary healthcare settings, such as the education system, the referral system they provide. It's basically, if we are hiring a nurse practitioner, we are basically deploying them in the far-flung areas where the access to the health services is not to the optimal level to all the settings, right? So, when you are deputing the person in different settings, in the rural setting, in different far-flung areas, so the need will be catered over there. This will ultimately reduce the overflow of the hospitalizations, right? And it will reduce the cost of the patients as well, because if they have a minor ailment, they could be treated at their own places in their own community, rather than they moving from that particular community to a very far-flung area, and there they come to know that this was a minor ailment, and they could be treated at their home place as well. So this will reduce their cost on the treatment, cost on the travel, and all that. And the other one is, there are cases which could be referral. So in that case, the primary preventive measures that can be taken at the primary healthcare settings level, in that cases, and even the we have lack of access to the maternal and child health, right? So nurses are already into the task of providing the maternal and child health care in the rural settings. So why not to provide them with a designation where they are free to work independently with of course there must be qualification regarding that, and that should be licensed, sure. So they work independently in the primary healthcare settings, where they can work on the maternal and child health, and reduce the morbidity and mortality rates, as you know that it is. And it will also help us in the we are already working there. The nurses are already working there as a community health nurse in different settings, in the different communities. So if this deputed role of nurse practitioner is there, then it will what will happen, then that will specialized person will be there, so they will be handling all these tasks, and they will be providing education, counseling, early detection, screening, and then the referrals. So this will all reduce the cost on the hospital settings. It will enhance the patient satisfaction, right? So other than that, if I overall talk about the return of investment overall, other than the nurse, then the nurses, they play a vital role. Why not to invest on them? So if we invest on them, we will be able to make them satisfaction. So they will not be moving to abroad and others. They will be having their privileged responsibility. They will provide their responsibility with more obligations. And when they will be providing handsome amount of salaries, when they will be regarded as whatever they are required for. So ultimately, if you want to go for any kind of accreditations for any kind of hospital, patient satisfaction, reducing the cost effect of the hospitalization, this can all be done by investing into the nurses. So my message to you and all the audience is that we should invest in nurses. If this is the nurses are healthier, we will have a healthier nation.
So this is the time that we should employ the nurse practitioners also.
Yeah.
We should start the education in nurse practitioner also. We should invest on the nurse practitioner education also. So thank you very much, the panelists and the audience. In a nutshell, that we can say that nurses has economic contribution, cost efficiency and savings, and of course their role was, which was very crucial, that our panelists had highlighted during the crisis and recovery, especially during the COVID-19. I would like to thanks again to the management of the Black Hole for providing this, healthy discussion. Hopefully, the audience have, had taken some home message that how much nursing profession is important in this country, that we should give attention from government level, high authority government level. We should fulfill the needs of the nurses, and of course we should uplift this profession. There is a lot of need to uplift this profession. So this was our home message. Thank you very much, audience. Thank you.
Thank you.
I would like to ask the few audience in front of us, if you have any question, our panelists are present here, you can ask the question. From the back side, if you have कोई question है तो बता दे, ताकि हम panelist को अभी request करते हैं कि आपको answer कर ले. जी please.
Assalamu alaikum to all of you, and thank you for this healthy discussion. So I just want to ask, can we use social media to recognize our profession or promote our profession to the upcoming generation?
Yes, sir. Who would like to answer,
Yeah.
please?
Yes, this is one of the important aspect, and actually it wasn't very much relevant to the economy. That's why it didn't come under our discussion. But I would like to highlight that the way we are portraying the image of nursing through social media, especially in our dramas and movies. So I would like to highlight this point, that by now the world has recognized the power of the nursing, and it's undoubtedly the most trusted profession in the US and other countries, and it is not for a year. Actually, it's from more than a decade that every year nursing comes up as a most trustworthy profession in these countries. And secondly, they are the backbone of the healthcare system of any country. So portraying them in a movie or in a drama in a very, in a very lower image sort of thing, it's very nonsense, and it's not giving, even it's out of the humanity. It's not even under the ethics, that why you are undergrading some of the professions over the others. So I'm not sure how those people are thinking about it, but it's the peak time that they should change their mind, and they should give respect and tribute to this noble profession.
Great, Sir Sajid. I would like to add a few words here. That social media nowadays, it's been, a very strong communication, and it has no boundaries. It is not only the country, but it is international. So we are a global village. So one example is today we are here at the black hole. We are using this medium to convey our message not only to our national way but internationally, that the capabilities of nurses to boost economy of a nation. It has been, nursing is one of that profession, because once they go, whether they stay in Pakistan or they stay outside, they generate money for the stability of the nation. So they send their money back to the Pakistan and all that. Social media could be helping us in raising the voice for quality education, quality training of nurses. And when there are quality nurses, then there should be a quality area where they earn accordingly, they respect accordingly. So then this profession and country will be flourish like nothing. Thank you so much.
Assalamu alaikum. First of all, I am very thankful that you people have very fruitful discussion today. We discussed that nurses are facing workforce burden and there are shortages of nurses. And we talk about this, how do we strengthen the nurses, and mainly we discussed that we can provide them financial benefits. But my point is that nurses are facing compassion fatigue due to the workforce, the burden of work. So how can, at a hospital level, we can decrease that mental distress of nurses?
I think Ms. Huma, please,
Yeah.
this is very important question.
Yeah, thank you very much, Nizar, for the pertinent question. You're very right. The nurses, because of the heavy shortage of nurses and even the flow of the patient, and not by recognizing the efforts they are being, so they do suffer from the compassionate fatigue. And in that regards, there are multiple ways of tackling that situation. Is basically, we have always been talking about that, how that we uplift ourselves, boost ourselves. When your inner self is satisfied, then nothing can stop you from doing any kind of work. So until unless you yourself is not motivated or you're not compassionate about your profession, so that compassionation basically come from the surroundings. I very much agree with you. In that case, as we have already talked about, that the organization which are hiring the nursing staff, they should recognize, they should set boundaries. Now it is that they should have a clear description of the jobs, that what pertinent jobs can be done by the nurses, right? There are other nursing aides, the other, they can assist in some of the things which can be done by themselves, and the role can be shifted to the other persons, and by delegation of the task. And it doesn't mean that we are delegating our skills or our competencies to the others, but yet we are delegating the task to the other healthcare profession, which can be done by themselves. And we have been talking about different models in which the nurses can work in order to decrease the compassionate fatigue. So by dividing the task among different personnels, by providing them the efficient salary, as we have already talked about. So if they are being given a handsome amount of salary, the paid amount of salary they require, so they will be a bit of the in a position that they will be not feeling. When you are paid for what you are, then you don't feel fatigue. And the compensation, that does not come from anything, but it comes from your inner self. So I would say that it's come from inner self. Yes, there are influential factors that contribute. So organization, they must need to be account that they, as we have already discussed in our prior discussion, that they should work on the satisfaction of the nurses. So that satisfaction could be providing them the benefits, in terms of the facilities and all that. And along with that, they should be part and parcel. They should be respected in every forums, right? So if you are doing any kind of, although, organization have started working on these things, say, for example, accreditations. When there is accreditations, there are the nurses are part and parcel of the team. So when they are provided respect, they are taking into account of all the forums, you yourself feel boost up.
Yes, thank you.
I have a
yes,
quick
please.
question. What if there is a ban on nurses going abroad in future? Can be.
That's very interesting, and I think we cannot put that ban in first place. We can, in fact, we can never ban a citizen to move around the world. He or she can go anywhere in the world unless it's a legal court case or something like that. But the point you highlighted is, of course, to address the shortage of nurses in the country. You want to fulfill that gap. But those nurses who are outside the country, the remittances they are producing and the money they are sending back to the country, it is equally contributing to the economy of our country. And in fact, those nurses are contributing in more meaningful ways than those who are staying back in the country. Although the basic care is provided in this country, but if you see on economical level, we are also quite underdeveloped. We are still developing. So we also need that economical growth and economical power, which these nurses are basically bringing. And in the past 6 months or so, this point is quite highlighted on the federal level, and our Prime Minister is even taking very much interest in increasing the number of nurses and nursing institutions in the country. But on the other hand, it's quite heartbreaking for nurses that increasing the number of street level colleges and then doubling the number of students in those colleges without taking care of the trainers and the resources available to them, what we are doing basically. I am surprised that what sense it is making that instead of 50 nurses, you are allowing a college to train 100 nurses without checking their computer lab, without checking the quality of the teachers they possess. So I think that will lead to a chaos. And as far as the ban is concerned, so it will have different repercussions, like demotivation in first place.
Thank you, Dr. Sajid. I would like to say one thing, that nursing profession is directly related to or directly proportional to humanity. And humanity never bends. So when humanity never bends, then nursing should not be banned. Because when we talk about...
What I want to say is, what if the third party don't want to demand nurses from Pakistan?
That's I want to tell you about it. I really want to tell. This is another picture. that is being somewhere. If you people keep our dialogue, we will definitely come and discuss on things. There are in developed countries, the ratio of skilled workers, specifically in health field, related to nursing, where human touch is being involved, it is getting at the lower level. People in developed countries now going for AI. AI give you all the information, but could not give you a therapeutic touch. In developed countries, they have a very good structure, but the family care to their senior patients and care to their infants and care for the older people, it has been missing. So this is our proud being a Pakistani nurse, that our family system will teach us so many things which they are teaching in their curricula already. So again, I would like to say that not only we are talking about the jobs, many of the nurses have been abroad for getting quality education, scholarships. And once they will have those quality degrees with them, which is not prevailing here in different sect of nursing, those people when come back. So we hope that the structure of nursing in terms of making policies and everything will be much better. One of the example I must say that our dean is been example of it. Postdoc faculty who has been a good educator, example of a good clinical nurse, example of sitting in the government policy making area, and she talks about it and gather every nurse from Pakistani length and breadth. So such type of education, it has also been one of the part of nursing. Thank you.
Assalamu alaikum. Thank you very much, all of you, for this healthy discussion. What I want to ask is about the income tax. What I feel is some nurses in Pakistan are well paid. Not all the nurses are underpaid. But the ratio of them going abroad is due to the income tax on their salaries. So how can you relate this to affect the economy of the country?
So do you mean the income tax deduction in Pakistan?
Yes. In private setup, the income tax deduction is much more on the salaries.
I think whether this is private sector or government sector, income bracket of the income deduction, is same in both the sectors. So do you say that due to high bracket of the income deduction, they are going abroad?
Yes. I have seen many nurses which say that due to maybe the impact of income tax is not which I thought of, but still I think this is one of the aspects that nurses are going abroad. Like in Sadia, the tax is minimal. They get all the salary which they are paid.
Okay. What do you recommend? What do you suggest for that?
I would like to answer her query.
Do you have any suggestion?
No,
Sir, I would like to. It's a good one of the perspective of some proportion of the nurses. Actually, one important thing you all have to understand that keeping in the country, the income tax slabs that is being recognized by the government, it is similar to every employee, whether it is being a nurse, a doctor, or whatever, in any healthcare team members. So wherever they are, they have the same. The nurses which is been going abroad, the major issue is being the discrepancy in their salaries actually. One of the audience says about compassionate fatigue. This is one of the reason that you've been so much compassionate, but at least being a human, you need some return of it, in terms of acknowledgement, in terms of monetary system. For the reason today we were discussing about economy. So whenever there has been a low wages, as I told you, there are very low wages in public system and in some of the private institutions that create burnouts. Beside this thing, one nurse, 40 patient in our nation right now. So what about the burnout and the fatigue? So major, if you just take an interview, but in a very good institution, when there is been resignation, they will take a resignation interview of the nurses. Most of them, they say the wages are so low that are not fulfilling the utility bills, the need. I have just give you a comparison right now in dollars and the rupee. So any one of you, if you want to add, thank you so much.
Please let me add to it. Actually, her point is very valid, and it's not particularly for nurses, as Ms. Sadia highlighted, that the income tax deduction is quite uniform. But I want to highlight that it's very much frustrating for any employee. If he is paying the tax which is nowadays employed on these people, then this tax must be utilized for the return of the services as well. If I am paying tax and I am again not able to go to the public hospital and I am going to the private hospital and paying huge charges, similarly, if my kids are, they don't have the transport system to commute to their schools, and there are so many returns of the tax in the developed countries that people happily pay tax to the government. But I do not understand that for what cause we are paying this huge tax to the government. That's why she asked this question, and it's very much frustrating. Even I personally experienced this this hesitancy and this thing inside me, that why I am paying almost like this much amount to my country if it is giving me nothing in return, no service in return. I feel no security, no facilitation, even if you are traveling, even if you are sick, if it is about your kids' education. So what is the return of this tax? That is something which is frustrating, and that's why it could be one of the causes which push the nurses to go out. Yeah.
I hope you got the point. Thank you very much. In the last, the management has told me that they have arranged a cake in. Oh, thank you very much.
Yes, the audience.
That is another, surprise from one of our participants. He arranged a cake as International Nurses Day cake cutting ceremony. Thank you very much, sir.
Thank you so much, Nizam.
So can we join all,
Yeah.
especially you, please come in front and then we will cut the cake.